Hello all. Today's topic is Bell's palsy versus facial palsy. So the definition Bell's palsy means it is a sudden onset of the lower motor neuron facial nerve palsy, and it is most common cause of the facial paralysis. And facial palsy means it is a general umbrella term what we use if it is an upper motor or lower motor. This is an umbrella term we use. It can be caused by stroke, trauma, or infections and tumors. So the type of lesion in Bell's, it will be mainly the lower motor neuron lesion, and the facial palsy means it will be an upper motor neuron. Lower motor neuron means it will be Bell's palsy. And the area of face involved in Bell's palsy would be the complete ipsilateral facial weakness, forehead is not spared, eye cannot closer, and mouth drops. This is very important, you need to remember. And the upper motor neuron facial palsy is that forehead will be spared and weakness is mainly present in lower faces. The lower face is affected, the upper face is not affected. Means it is upper motor neuron. If both is affected, it would be lower motor neuron. The onset, the Bell's palsy would be sudden in onset. The facial palsy would be a gradual onset. The causes of Bell's can be idiopathic. The cause cannot be known, would not be known sometimes, and it can be to exposure to certain viral infections. And facial palsy would be because of stroke, trauma, infections, and other conditions. The associated symptoms in Bell's can be hyperacusis, the taste loss, decreased tearing, and in upper motor neuron facial palsy, it can be no taste loss would be present, but other stroke signs can be there. So the treatment Bell's palsy, we have prednisolone in the earlier stage. Eye care need to be done for lubrication and taping, and physiotherapy it needs to be done. Then upper motor neuron facial palsy, we have stroke management which needs to be taken care of and facial exercises after medical stabilization. This much we learned. In the next videos, upcoming videos, we look at the further things after this. Thank you.